Executive Director of the PCA, and I am so excited today to have one of our long-standing strategic business partners with us, Heather from Chiro Health USA. Chiro Health USA has been a partner of ours for many years. You know her from conferences, from doing talks at our PCCI, where we talk about practice management and how to build properly and make things happen. Heather is a superstar, and I am so excited to finally be able to interview her today. So, Heather, thank you for being here.
I'm happy to be here. I started with Pennsylvania going on 14 years. I was attending conferences. Yeah, one of my favorite places to come to is the PA for sure.
We're so glad to have you, and we're really appreciative of the partnership that we have with Chiro Health USA and the support that you've shown us throughout the years. So let's get into it. Heather, I sometimes hear from docs and I'll say, hey, have you thought about using Chiro Health USA? What is Chiro Health USA? Can you give us just a 30,000 foot description of what it does, what you do, and how it works?
I could probably go on for a few hours about Chiro Health USA, to be fair, but to give that elevator scenario, CHUSA, as you mentioned, a lot of people either know us as Chiro Health USA or CHUSA. CHUSA is our acronym, but what it really does for practices, I want to be clear, is that it helps replace the uncertainty with a contracted legal structure. I think this is key because so many practices actually utilize that DC on the end of their name for doctor creativity sometimes when it comes to fees. So what I like to put out there, what CHUSA does is replace the uncertainty with a contracted structure. So instead of the doctors chasing insurance rules that are changing constantly, clinics that use our membership model to establish a predictable fee schedule. All right. One of the key caveats that I like to mention that we typically see providers who are part of the network see an increase of actually 20% or greater in their revenue in their first year of using CHUSA. And I like to say it's because you stop the leaking bucket, right? You stop that leaking revenue through inconsistent discounting. It also turns chaotic reimbursement into something that's consistent and predictable. So CHUSA is one of those tools that you can put in your office that just cleans up a lot of messes and then helps practices obviously be compliant in many areas.
Many Pennsylvania chiropractors will say to me that they struggle with like the uninsured or underinsured or people with really high deductibles. How does CHUSA remove some of those financial barriers? What can CHUSA do to help with those situations?
A lot of people who do know CHUSA don't realize, even I want to be very clear because we might have some established CHUSA practices that listen to this as well. And what I found over the course of my time here is that some even the established practices don't know of all the areas in which they can use CHUSA. So one of the things that I like to point out is that what we do is we remove the fear of the bill. Okay. And that's by helping to provide total transparency. So for high deductible and uninsured patients, which are essentially self-pay, right? For at least, especially the first few months of the year, that's a huge barrier. So CHUSA allows providers to offer a single $49 annual membership that actually covers the whole family. And that turns that high cost hurdle into an accessible fixed entry point. The other piece that I want to point out that a lot of practices get creative with, but can use CHUSA for, it's not just the uninsured patients, but Medicare patients.
Yeah.
And a lot of practices, that is a pretty decent demographic when we look at the breakdown of percentages of the demographic of patients, whether they're commercial insurance, PI auto, cash, or even Medicare. A lot of practices have Medicare patients. It's 20% or more of their practices. But what Medicare patients don't realize, I like to say Medicare patients think that Medicare card, that red, white, and blue card, is a coupon for free care. But what they don't realize is that their coverage is really quite narrow in chiropractic. Obviously, it covers the adjustment, but zero for the initial exam, x-rays, therapies, things like that's an out-of-pocket cost. So without CHUSA, that particular senior on that fixed income might actually be hit with about a $200 bill on day one just to get the services that they need. But you incorporate CHUSA in there for all those non-covered services, that provider makes the full care plan now affordable from the very beginning so that when patients see a fair price up front, they can move forward with care instead of waiting for a crisis to happen, even in Medicare.
Yeah. And just that peace of mind of knowing that you're smoothing out the bumps.
Hmm.
It's got to be something, especially for your staff who handles a lot of this day in, day out, and having to interface directly with a patient. Boy, that's got to really be a load off their mind.
Yeah, absolutely. And team members, a lot of practices are sometimes hesitant to incorporate Chiro Health USA into the office because they think it's going to disrupt the team. And actually, it's quite the opposite. Team
Mhm.
members love Chiro Health USA because it makes their jobs easier.
What specific compliance risks does CHUSA eliminate for providers? And I know you spoke about this earlier in offering discounts and hardship discounts with patients. What specifically do you offer to help with that?
So there are a lot of rules and regulations that, depending on the practice, that they could be breaking. The two that I'll speak about, though, that come to mind initially are dual fee schedules
Mm.
and inducement violations. So a lot of offices, Mike, they really do mean, and a lot of them make up discounts on the fly. Like, for instance, given that senior discount, that's a direct violation of the federal anti-kickback laws.
Oh.
Cannot offer free or discounted services to Medicare beneficiaries. This is going to basically, what Medicare would see is you entice them to come into your office, right?
Mm.
CHUSA replaces what I would say that risky behavior with a legal safe harbor. So it protects the doctor from accidentally doing something that's illegal while still allowing them to be compassionate as a provider, which is ultimately what they want to be. No free services. My fees are nothing is free.
It just makes it such an easy guardrail then to stick to that so that you're not in any way stepping over that line. Because you go over that line, you said it before, it's good intentioned, right? You want to
Yeah.
help, you want to facilitate and really meet somebody where they're at, but you've got to protect yourself, you got to protect your practice and your team members, and that's just something that has to go into place. When a
Mhm.
family joins CHUSA, how does it change the kind of long-term engagement with chiropractic care? How does it really affect the whole family and the household care?
Yeah. So I'm going to use this word again, crisis. I used it in the Medicare decision earlier when we
Mhm.
talked about that. But what I would like to frame it at is it changes chiropractic from that crisis decision into a household habit.
Mm.
Crisis decision, meaning, oh, I'm in so much pain, versus we're going to the chiropractor. It becomes their habit. Because the membership covers the entire household, families know that they can afford to bring everyone in. This is why ultimately on our end too, Mike, this is another interesting number. We actually see patient retention in our practices go up around 50% or greater when they use the network. So ultimately, the practice can stop seeing patients as a one off visit, meaning my insurance ran out or I just can't afford to do all of this. And they can actually start family serving as units of care.
I love that. You'll hear people go, I can't afford to be injured. I can't afford to be hurt at this time. And that really takes away or eliminates that fear from really getting the help that you need. So that's fantastic.
No one
No.
wants to guess about things. If you can present that to them and it becomes something that's predictable, I think that's a huge thing to take away as a patient perspective. Put yourself in their shoes for just a moment. They're hurt, they're in pain, they need maintenance here, whatever path they're on, they just need to know up front what's it going to cost, because it has to fit into their structure. For you as the practice, it also has to make sense, right? So you have to make sure that the numbers are where they need to be so that you're not violating rules, regulations, things like that, and you're still helping the patients. Because ultimately, Mike, if the practice isn't around, who's going to serve the patients?
Exactly. And here in Pennsylvania, we're really struggling with losing some hospitals. We have what we call care deserts now. And so
Mm.
we really want to be able to obviously hang on to the providers that we have and have a resource for them. Can you walk us through exactly how a provider gets paid for the through the program and why clinics see an immediate uptick on the flow of stability and
Yeah,
stability?
that's a great question. So I like to think of Chiro Health USA as you didn't have to chase the dollar scenario, maybe a point of sale collection, because this is ultimately using Chiro Health USA replaces your cash fee in your office. It
Mhm.
becomes your cash fee. So clinics are paid directly by the patient, and that can be at your policy at time of service. Let's just say that's the case. Using that structured CHUSA pricing that they put in place, that means that now the practice isn't waiting on insurance processing, chasing EOBs, because the pricing is clear.
Right.
Agreed. We just talked about that. The pricing is clear and it's agreed up front. So obviously, collections are going to improve naturally. And this immediate shift to cash on hand is one of the reasons that we see practices have an uptick in their stability when it comes to their ROI.
You've been a speaker for us in the past when we've invited in the entire team, and we believe at PCA that the entire team should be a part of their membership of for the Chiropractic Association. And what is your answer when someone says, "Is this going to cause a massive administrative burden as being a part of this?" I know some docs are very cautious in making the decision to join a program and an opportunity like this because they go, boy, now I'm going to have to retrain my staff. I'm going to have to figure this out. And I don't know how to do all this stuff. And I have about 10 minutes in the day to do this. How does CHUSA really help with that kind of administrative burden?
One of my favorite things is it's cheaper to keep them, right? Obviously, if you have the right people in the right seat and understanding policies and procedures, again, yeah, I could teach on this aspect from a team member's approach as well. It's really important to have policies and procedures in place because that relieves the burden. But when we talk CHUSA specific for a moment, think of it as an administrative relief tool.
Nice.
It replaces what I would say is a dozen different handshake discounts with a single clear policy. And this isn't me saying it. These are my front desk team members that come back to me, CAs come back to me and say, we're not negotiating or guessing what's allowed anymore. We have a clear system that we can follow. So when that happens, imagine the stress gets reduced. It shortens that financial conversation that they're having, which the team members should be having and not the doctors. And it makes training even new team members significantly easier because now you're not having to guess, this is what we do for this patient. No, this is what we do for these types of patients. They're either in this category or this category. So it adds a system that works because obviously if you introduce systems that doesn't work, then nobody's using it. And ours is truly built to simplify.
There's there's a little bit of mistrust within the chiropractic community, or I should say amongst consumers with the chiropractic community. And is my insurance going to take care of me to the point where I'm better? And on the flip side of that, case acceptance and ongoing treatment plans. And you would hate for there to be a situation where a doctor or practice would have to weigh the two, right? The ongoing care, and obviously a doctor is going to put the patient first always, but also knowing that an insurance company only pays X in total visits, the copay is so high. So how does CHUSA help really with kind of that legal structured discount program that allows for that case acceptance and ongoing treatment plans?
Yeah. So first and foremost, what I would say CHUSA to define what CHUSA is in that realm of legality, the acronym of the day would be DMPO, which stands for Discount Medical Plan Organization. So that's how we get to do everything that we do. But to answer that specifically, I would say that think of it like this: when trust goes up, when the pricing is clear and fair.
Agree with that 100%.
Right? So patients don't feel like they're being sold something different and then say the next person that's sitting next to him. And by the way, patients talk. You never know who's related. You never know who they're bumping to at the grocery store, things like that. They're going to talk in your waiting room. So patients don't feel like they're being sold something. And then there's what I would say, let's call third-party credibility. We all know who Blue Cross, Cigna, Aetna, and all those things are, whereas we have different opinions on this side about saying those words. A patient who buys into Blue Cross, there's credibility to that, right? Cigna, there's credibility to that. So being part of what I would say a national network like CHUSA is going to improve case acceptance because patients understand exactly what they're committing to financially. So when cost fears go down, consistency of care would go up.
I love that. I love that. As a matter of fact, I think we should get t-shirts that say that. I think that's great. Does CHUSA sell t-shirts that say that? Because I would wear one. I would.
Sell though, but we do have a different theme every year, and we're about to release this year's theme, and it's a pretty awesome t-shirt. I'm gonna have to drop one or two in the mail to you. You'd like it.
I appreciate that. Okay. What can you give me an example? Is there a success story that you can share with me on really, what a practice saw immediately or through the relationship with CHUSA and the impact that it had on both their collections and their patient satisfaction?
Yeah, we got tons of testimonials on our website.
Yeah.
What I would probably point back to is that the real success for me is in the data. And that's something that I began really looking at around 2020, working with practices on their overhead, understanding the value in their usual and customary rates. And that 20% growth and 50% retention that I mentioned earlier, that is something we see across the board. It really is. And they'll say, Heather, it's greater than this. And it is paying attention to numbers. They obviously tell us that they have fewer financial objections, meaning more patients do commit to care. The biggest thing, I would say, two big things, is that they do have a happier team at their front desk, things like that, because over all of that, in other words, again, it's cheaper to keep them rather than having to retrain, putting processes in, happier front desk. But the biggest one we hear, and you said this earlier, and that's why I smiled really big. You said peace of mind. We hear this phrase so many times. The doctors finally feel protected legally, and the patients feel like they found a healthcare partner that they can afford. It is peace of mind.
Yeah. I love that. I love healthcare partner. I really think that matters, right? Because there are so many people that are out there that are doing maybe sometimes the same thing. Maybe there's somebody right across the street, but when you find that spirit that you connect with them and you really find that partnership, that kindredness, that I think that's really important long term. Heather, one of the things that the PCA is really working on here is we're like a lot of other states where a lot of chiropractors are getting to the age where they're looking to retire and exit. And so a lot of young chiropractors are coming in and either taking over practices or putting out their own shingle, if you will, trying to get a practice started of their own. Why should a young person, a young chiropractor just fresh out of school who has the opportunity to start their own practice, start with CHUSA?
Oh, this is one of my favorite things to do, genuinely, because they don't know what they don't know. All right. Chiropractic school, great. It teaches them how to become a chiropractor, how to treat the patients. They don't teach them how to run the business.
Right.
They don't give them the information. So many chiropractors who are just out of school and they're opening their business for the first time forget that they're opening a business and that there are all of these things. So why would you use CHUSA in the beginning, a brand new clinic? Easy. We help you make sure that you understand the goals that you want moving forward, the value that you bring to not just the profession, but to your community, kind of understanding on a granular level. But to actually use CHUSA would be, how do you market your brand new practice to patients? Because you may be locked out of networks and you're going to get people who want to use insurance calling in all the time. I've got this. Unfortunately, I can't get into the network. Or you're waiting for credentialing, all of those things. There's marketing opportunities. We can't tell anyone what to set for their usual and customary rates. There's legalities behind that.
Sure.
But that's probably one of the bigger struggles a brand new clinic has, because they can't call the clinic down the street and price themselves based off of that. So we help give them resources on usual and customary rates, what is common, and how they could market themselves. They get family opportunities, in other words, to market, to bring in the foot traffic for them. There's just so many pieces, truly, for a brand new practice that could use CHUSA.
Yeah, I really like that you brought in that marketing side of that as well. And you're right, doing a market survey, it's amazing to me. I went to business school, so I'm not a chiropractor. And it's amazing to me how many chiropractors, they've spent all that time in school, they spent all that money on school, and they're given a diploma and a handshake and good luck to you, and you've got to go make your own way. And being able to have a partner who is able to give you that insight is priceless. And
Yeah.
I'm glad CHUSA does that. As healthcare costs rise, and we hear this all the time, it seems that a lot of the coverages are covering less and really not as affordable as it used to be. I hear a lot, and it used to be an anecdotal things that people would say that we get paid more from the copay than we do from the reimbursement and all the work that they have to do to get that reimbursement. So with that in mind, with kind of a race to the bottom that it has been for a lot of providers and payers in this type of situation, how do we make it affordable and accessible for the community and to bring people in? I know you talked about the marketing, but I think we need to maybe drill down on that a little bit more.
Yeah, this is where I could probably get on a soapbox, Mike, and talk about the importance of setting your fee at a fair market value and not just throwing something to the wall and hoping that it sticks. Because what a lot of practices don't realize is that these insurance companies use that data against us. So as we see reimbursement, as we go down and down to the point where Medicare pays more for an adjustment than commercial insurance, that shouldn't happen. So there's a whole other side quest that we could go on within that respectfully, it is important that they critically pay attention and update their usual and customary rates and have access to resources for that, whether the state provides that or then I've got some sources as well for that. It's really important, super important, because we shouldn't be racing to the bottom. If anything, we should be closer to the top now. And I feel like that is one beat that practices miss, again, which is why as a brand new practice, when you're not having to undo some things, it's really important to set yourself up for success from the beginning. But we drilled down a little bit more. I said I would think that we would help clinics become the solution for when insurance fails, because 9 times out of 10, it probably is. You've got a lot of hardship patients out there. There are states that are losing coverage for some of those patients out there. Chiropractic is involved in that. It's just not a good season with insurance. And we really have to work on that more behind the scenes. And I can tell you that there is a lot that is working on a lot of volunteers that are working on behalf of this profession from all corners of the United States for fair and equal reimbursement. But when it comes to CHUSA, coverage can be very confusing, and patients need what I would say is a fair alternative. So if they're high deductible, high copay, if they exhaust benefits, if they're Medicare, or if they really have insurance, CHUSA gives clinics a way to say, even if your insurance doesn't help, we have a plan for you. I think it positions the chiropractor as the most accessible, high value provider in the community. Clear transparency. We like to say clarity is kindness, by the way.
I like that. I like that a lot. And I 100% agree. There's a lot of innovation happening these days. There's a lot of AI talk that's been happening these days. So, looking at the next couple of years, what kind of innovations and expansions and really integrations do you see CHUSA adopting that are going to make even more valuable for our PCA members?
We have so many resources and things that are at the fingertips of so many people that they just don't know that we have or didn't realize that we could help with that, because a lot of people want to put CHUSA in the category of that's just how you give cash discounts, and
Right.
it is so much greater than that. I would say our focus is making compliance invisible and effortless. We are deepening our integrations with EHRs and payment platforms like Cash Practice that help make that transition easier. In other words, documented and compliant without having to do a bunch of extra work. We're also doubling down on education to keep clinics safe and sustainable as healthcare keeps changing. It is one of those things that every day you wake up and there's something else happening. The biggest thing, and I'm proud of this, and I can announce this here, we put it out on Facebook last week. For many years, we did a webinar series that was hosted every week, and we stopped doing it. We stopped doing the webinar series. It was just one of those things where maybe it's time we just go over to a podcast. We're still going to have our Chirosphere podcast. That's with Dr. Ray Foxworth, and that's hosted, I think, twice a month. He does some podcast interviews with people, amazing people across the profession. But what I kept hearing when I would come to so many events was, we really miss your webinars. And I'm just like, oh, I know, those were great. They're still archived. I'm bringing them back.
Oh, that's great.
Bringing them
That's
back.
great.
So there'll be monthly webinars starting next month. Our first host is going to be Evan Gwilliam. And my goal this year, and I'm only doing one a month with quarterly bonus episodes that are strategically there for team members and doctors. So I want everybody in the practice to have something measurable they can walk away with. So I was very strategic with planning out these webinars so that it was relative information that practices could use now.
That's so important, and that's exciting to have it back, because I do remember those, and I remember people really appreciating them. So thank you for bringing them back and all the hard work and putting that back on. I know it was hard work before, and we appreciate it.
Yeah.
Heather, you've been an amazing partner of the PCA. Let's say somebody listens to this and goes, Heather's making perfect sense. I've met her about a half dozen times, and it's time for me to make a decision. I'm tired of being tired of the process, and I'm going to reach out to CHUSA. How long does it normally take somebody to connect with CHUSA, to go through the training, and really to integrate it within their practice?
I would say we do a couple different phone calls, one to get what it is you want your fee structure to look like, and then we do a training with your team. I would say the average length is less than 2 weeks. to do
Wow.
that, but it really depends on your scheduling because I have practices that come through the gate and they can be one and done in a matter of 2 to 3 days.
Okay, that's great, and that's so easy. That's so quick, and what a incredible change, especially if we can hit that 50% number. That's nothing to sneeze at. Heather, I'm going to give you the floor to go ahead and give us your last little elevator pitch. Why should they should reach out to you? How they should reach out to you, and then we'll close up here today.
Yeah. What I want to leave with too is that we are chiropractic owned. So
Mm,
this isn't a third party anything. We are chiropractic owned. It's really important for me to also say that Chiro Health USA costs your practice nothing.
yes.
It costs you nothing. If anything, it helps boost that revenue. And we give back to this profession. We give back directly to the PCA, which I think is really crucial for the profession to understand that there are so many avenues that state associations are removing barriers so that practices can practice.
Mm,
Right. And so that's really important to us. So membership into Chiro Health USA is paid for by directly by the patient. $49 a year covers them and their household. Doctors don't pay anything.
mm.
We don't want this to cost you anything. We want it to protect you. Reach out to me if you've got questions, whatever it looks like. I'm going to be honest with you. I turn practices away all the time. I'm going, you're doing it right.
Right.
Like, I applaud you for doing it. So communicate with me, I think is the biggest piece. And you can reach me at my email, heather@chirohealthusa.com. You could call the office and chat with the girls anytime you need to. We're Mississippi girls, so you're going to get the same Southern accent. And I am just appreciative of you, Mike, and your amazing team at the PCA. And I've made some great friends up there and really appreciate the profession. You guys mean a lot to me. You don't realize how much it means to you. But yeah, I really appreciate you guys.
We appreciate you, Heather. Thank you and to the entire team at CHUSA for what you've done for us. You do support us and you do help us advance the work that we're doing, and we appreciate you for that. On behalf of Heather at CHUSA, I am Mike Barber from the PCA, and I thank you all for watching.